and I'm totally committed to it. I think it's an incredibly important problem, but I think it's one of the most exciting areas in translational research right now, probably the most exciting area in translational research.
Have you taken nutrition to the limit with the mouse model, or can you do more there?
Well, that's kind of a hard question. I think what we've seen in the mice is that they get their nutrition from their mother, and they have no other option, really, under normal circumstances. And that's unlike humans in many ways. Obviously, when a young child or baby is struggling for nutrition, there are a lot of ways that we can intervene in modern medicine to help. And it's harder to do that in mice. What we see in the mice is that when we give them extra nutrition, they can do better, particularly in the context of receiving some sort of drug therapy at the same time. But it's true that we don't exactly know why that happens, why the mice do so much better with drug and nutrition together. We have some new ideas about why that might be happening, nothing that's advanced enough to talk about yet, but I think there's a lot to be done to understand that synergy better. But right now, we really don't have the answer there. And how to translate that to humans is also quite unclear. I think there's been a lot of interest in knowing in patients what should our recommendations as physicians be? What kind of diet should children with SMA have? And we don't know. We don't know how to counsel patients best about what type of diet would be the best for them. And there should likely be more rigorous study of this, and perhaps even studies of different diets in different patients, but it's difficult. Nutrition is a really complex area.
What about exercise? Do you feel like there's more to be done in that realm?
So again, this is something that was studied once in SMA mice by one laboratory and did show some benefit in the mice. The suggestion was that exercise allowed the mouse motor neurons to work a little better, and the connections with the muscle seemed to be a little bit healthier. But it has not been studied rigorously in SMA patients. There's actually an effort now in patients with ALS, Lou Gehrig's disease, which of course is an adult motor neuron disease, to study exercise more rigorously and to really test it in a clinical trial, different exercise paradigms, and see if different paradigms actually make a difference. There has to date not been that kind of effort in SMA, but I think would be a reasonable thing to try. It's the $50 trillion question, I guess. Mice are not humans. I take care of humans and I take care of mice. And I think we really do need to make a big effort of doing studies in both humans and mice and translating between humans and mice more often. Obviously, it's a lot easier, and the sorts of things that we can do in mice are more extensive than some of the things that we can do in humans. But we can't assume that because something is the way it is in a mouse, that it is that way in a human. And we have definitely made an effort in recent years to try and address that, to try and do more studies, some of the things we've done in the mouse, but also try and look at similar things in human tissues, for example. So I think that's extremely important. I think one of the things that I'm most excited about, though, in the field is really only become apparent in the last year. And that's the fact, and again, it's the mouse. But again, in the mouse, it's been shown now in several different ways, either by replacing the SMN1 gene by gene therapy or replacing it by genetic engineering methods, that you can completely, essentially rescue the mouse from disease when you deliver therapy postnatally. So in a mouse that only lives 2 weeks, you can treat that mouse at birth, and that mouse will basically have a normal lifespan. So that is an incredible result and an incredible lesson for us that there is a window of opportunity for treating this disease. And if we can intervene with the right therapy at the right time, we can have just an incredible impact. So I think that hopefully, and that's another question, how does that translate to the human? When is that window of opportunity in humans? And will we be able to achieve that same kind of treatment efficacy? But these are all questions that are that will be answered, I think, in the next, the coming next years.